Dr. B, can you help me? Dr. B, can you help me?
In this week's edition of Dr. B, Can You Help Me? I'm going to be talking about acute injuries. An acute injury is just an injury that has recently happened. Some factors that are related to acute injuries could be trauma. You know, you're out there playing pickleball, you fall on your shoulder. There's a reason why that area is now injured. Could be a broken bone, could be a strained muscle. Another factor is level of fatigue. Say you've been playing golf 6 days in a row. You start to feel a little inkling of that pain in your back, and then on that sixth day you do a swing and boom, then you feel that pain in your back. That is more of probably a fatigue issue. There's compensation. Prior injuries require that the body kind of change how it's moving to accommodate that prior injury, and that's what we call compensations. That can make one area of your body have to work a lot harder because of that injury, even if it was an injury a long time ago. Also, overuse. That's a big one for acute injuries. You know, once again, I played a tennis tournament. I'm not used to playing 3 days of tennis in a row. At the end of that, I pull a hamstring muscle. The biggest thing with these, and most patients are pretty in tune with this, they don't want it to reoccur. When they're going through that acute injury process, oftentimes they have to quit their sport. There might be swelling, there might be bruising, there's pain, but all of my patients who have gone through an acute injury all talk about, Brian, what do I have to do to not have this happen again? And that's where you need to have a really good physical therapist on your team to evaluate, well, why did it happen in the first place? If we can get to the root cause of that problem, we can do our best job trying to avoid it in the future.